In this lesson, I'm going to help you understand the various opioids that are used as analgesics and when you will use them. All right, so opioids are used to treat pain that occurs. So they are given for moderate to severe pain, and the patient could be in labor. This way, or for this type, they're usually going to be given IV medications that are going to act fast. And they are not providing the same numbing effect that an epidural would, but just kind of can help take the edge off for a little bit. During the postpartum period, they are usually going to be treated for pain that's going to be given for PO, so for cramping, incisional pain, or that episiotomy pain that they might have. The patient will need assessment for her history, okay? So we need to know if she has been taking opioids throughout her pregnancy or has a history of opioid use or abuse in her history, because obviously her threshold is going to be a little bit different if she is used to taking medications, but we also need to know if she has a history of abuse or anything, or has been taking them because of the baby, because it could put the baby at risk. We want to know this so that way we can treat the baby properly. So there's a lesson on the addicted newborn, so you can look at that for more information on that. The patient's pain level, this is also going to be frequently assessed, right? So we need to know what her pain level is so we can medicate her properly. And we need to know how close she is to delivering a baby, because we do not want to give a narcotic if she is about to deliver, because it can do respiratory depression for the baby. The baby can be born with respiratory depression. So we always need to know how close she is to delivering. If she's nowhere close, then it's okay to give her that narcotic, but otherwise we might need to wait. Let's review the different medications that are going to be given. So we have to manage our patient properly with different pain medications. So during labor, medications like hydromorphone, morphine, butorphanol, all these long words, tartrate, or that's Stadol. These are going to be the most widely used. Oh, another one, the nalbuphine or Nubane are options to give. So these are for our labor. In the postpartum time frame, the most widely used opioid medications are going to be our oxycodone. And with these opioids, we want to have for all, we want to have naloxone, or Narcan, available, so to reverse any types of overdose effects that they might have, and also have this at the bedside for a newborn that's being born shortly after any of these are given during labor, to reverse that respiratory depression that the newborn might have. So our additional management, besides giving the opioid analgesia and the naloxone being available, are going to be anti-nausea medications. Sometimes it's just a side effect of these opioids. They get nauseous. So that way we can help treat them for any nausea that they might be having. Monitoring for an overdose. So a patient that has respirations that are less than 12 a minute is a concern. So we want to watch for that. And for hypotension, things that we'll watch for. We will educate the patient on the medication options. So what are her choices? What kinds of medications do we have for her or ordered for her, and let her make the best option for her. And then we want to help educate the patient to let her know which ones are going to be fast acting and work best for the pain that she's feeling. Pharmacology and safety are going to be our concepts, because we are talking about medication, and the safety of the patient is going to be important when receiving these opioids. Okay, so what is important to know? Opioids are used as analgesics during labor. So these are going to be typically our IV medications, and they're also given in the postpartum period, PO typically. They are not going to be as numbing and take away the pain like an epidural, but they can be fast acting and help with the pain. And then we want to have naloxone available specifically for the newborn after delivery if any respiratory depression is occurring. Make sure you check out the resources attached to this lesson, review all the key points. Now go out and be your best selves today. And as always, happy nursing.